So hello guys, our today's topic is gingivectomy. So what is a gingivectomy? Gingivectomy, it is a surgical procedure that involves the removal of the gum tissues, that is the gingiva, often to treat the periodontal disease or improve the appearance of gum. On definition, it is the excisional removal of the gingival tissue for the pocket reduction or elimination. Whereas gingivoplasty, it is a surgical procedure that is aimed at reshaping and contouring the gums tissues. The definition is reshaping of the gingiva to attain a more physiological contour is termed as gingiva. Now, what is the aim of the procedure? The main aim is pocket elimination for root accessibility and establishment of physiological gingival contours. So it eliminates the periodontal pockets and the abscess. It also removes the fibrous or the swollen gums tissues that can be removed through gingivectomy. So the indication are the elimination of the supra-bony pockets in the presence of adequate zone of the keratinized tissue, or in case of fibrotic gingival enlargement. So gingivectomy, it can reshape the gum margin to its natural form, improving the overall gum health, enhancing the aesthetic form, creating bilateral symmetry. So by removing the excess gum tissue, gingivectomy can expose more of the tooth clinical crown, aiding in the restorative procedure also. Uneven gum surfaces or gingival craters can be corrected through gingivectomy procedure by improving the gum contour. So there should be adequate enough attached gingiva remaining after the excision to ensure proper functioning and stability of the gum tissue. The underlying alveolar bone should be in good shape or have horizontal bone loss. So there should be absence of the infra-bony pockets. So the absence of deep pockets in the bone is crucial to achieve the successful result from the gingivectomy procedures. Now, it is indicated in case of incomplete passive eruption, unaesthetic or asymmetrical gingiva to facilitate the restorative dentistry, to establish physiological contours, to correct the gingival craters, and to treat some cases of furcation involvement. So these are the indication of the gingivectomy. Now, what are the contraindications? Absence of adequate zone of keratinized tissue, pockets that extend beyond the mucogingival line, treatment of the infra-bony pockets. Remember, the gingivectomy and gingivoplasty, they are not appropriate when the infra-bony pockets are present, as they are not designed to address the deeper periodontal tissues. It is contraindicated in thick alveolar edges, interdental craters. So these conditions may complicate the surgical procedure and are not suitable for gingivectomy or gingivoplasty. So when the pockets extends below the mucogingival junction, that are also contraindication of the gingivectomy procedure. When the gingival enlargement is due to blood diseases, example leukemic gingival enlargement, all these are contraindication. Good oral hygiene is essential for the surgical outcome of procedure. Poor maintenance can lead to complication and hinder the proper healing. Uncooperative patient could affect are not the medical compromised patient or the uncooperative patient who are unwilling to follow the post-operative care may not be suitable for candidates for the gingivectomy and gingivoplasty. So what are the advantages? There is ease of pocket elimination, good access to the tooth surfaces. Disadvantages: there is healing by secondary intention, post-operative bleeding could occur, loss of keratinized gingiva, and inability to treat the intraosseous defect. So these are the disadvantages. Now, what are the various types of gingivectomy? It could be surgical gingivectomy, gingivectomy by electrosurgery, laser gingivectomy, or gingivectomy by chemosurgery. The first is the surgical gingivectomy. So that the surgical gingivectomy that is done with the help of surgery. Armamentarium required for the surgical gingivectomy is you need mouth mirror probes, pocket markers. Pocket markers, example is the Kaplan pocket marking forceps. They are the instrument. They are used in periodontal procedures like gingivectomy to assess the marking the depth of pocket on the surface of tooth, allowing the dentist to assess the depth of the periodontal pocket. So this information helps the dentist to plan the extent of gum tissue removal during the procedure. Other are the Kirkland and Auburn's interdental knives, surgical blades including the Bard Parker handle, curettes, Gracie curettes, tissue forceps scissors, and the periodontal dressing. So this figure represents the Kirkland knife. If you get an MCQ question in your exam, identify the instruments. These are the instruments. Number one, used for the gingivectomy procedure. Second, the instrument's name can be asked. This one is the Kirkland knife. This one is the Auburn's knife. This is the BB blade of various sizes. So, during gingivectomy procedure, various type of incision can be made. So one of the most common incision that is used in gingivectomy is the external bevel incision. So the external bevel incision, it involves the creating an incision that starts on the gingival margin and extend apically at slight angle to the tooth. The angle of the bevel, it is usually 45 degree. So this type of incision will help to remove the disease or excess gum tissue while ensuring a smooth transition between the treated area and the remaining gum tissue. So creating a bevel incision at 45 degree during the gingivectomy procedure can serve various purposes, like it helps to minimize the trauma to the tissue edge, promoting better healing. The angle of bevel reduces the tension. So number one is improve healing. Second, it reduces tension. The angle of the bevel, it reduces tension on the tissue when they are sutured back. So this can lead to better wound closure. Third is the better aesthetic outcomes. So the beveled incision can result in smoother transition between the gum tissue and the excised area that will improve the overall appearance of the gum line. Better blood supply. The beveled incision can maintain a better blood supply to the tissue edge. And last is the reducing the scarring. So properly beveled incision can lead to less scarring. So what could be the procedure? Numb the area with the local anesthesia. Infiltration can be given into the marginal and papillary tissue. Second, keep the area dry for the visibility. Pocket markers to assess the pocket depth. So this one is the Crane-Kaplan pocket marking to identify the pocket depth. So pinpoint bleeding points, they are created, they are marked. So the pocket markers, they are used. So this one is the pocket marking forceps, that is the Crane-Kaplan tweezers. So you have to just mark the pocket depths. Then the incision can be done with the help of gingival knives, gingivectomy knives, that is the Kirkland knife. So the incision is beveled at 45 degrees to the tooth surfaces, creating an external bevel incision, and use the Orman's Kirkland blade to excise the excess gum tissue. So you have to control the bleeding, suture, and post-operative instruction can be given to the patient. So if incision has completely separated the pocket wall from underlying tissue, pocket can be removed easily using a curette or scaler. The fibrous connective tissue and the granulation tissue, they are removed through sharp curettes. Any further trimming of the gingiva could be done with the help of fine scissors. The residual calculus on the roots should be scaled off, and roots should be planed leaving a clean and smooth surface. Periodontal dressings can be given afterwards to protect the wound for irritation, to control bleeding, to control the excess granulation tissue, and post-operative care instructions can be given to the patient. So these ones show the primary beveled incision, the interdental incisions, tissue removal afterwards, removal of the granulation tissue, and afterwards periodontal pack that is given. So the first few days the patient might experience mild discomfort, swelling, and some bleeding. The swelling and discomfort typically starts to decrease during 3 to 7 days. The gum tissue begins to heal, and pinkish granulation tissue that is formed over a week, over 1 to 2 weeks, and it is important to maintain good oral hygiene during this phase to prevent the infection and promote the healing. So healing after gingivectomy, the epithelial cells migrate from the edge of wound beneath the clot. They cover the wound in 7 to 14 days and keratinize in 2 to 3 weeks. And formation of new epithelial attachment may take as long as 4 weeks. So remember this for your entrance exam point of view. Other procedure that can be done is electrosurgery. So what is electrosurgery? It is a technique that involves the use of the electric currents to cut or coagulate the tissue. So a high frequency current of 1.5 to 7.5 million cycles per second is used. So the patient first of all is prepared for the procedure, often with the local anesthesia to numb the area. The area is isolated. A specialized instrument known as electrocautery is used that consists of an active tip. It has an active tip and a grounding pad. So the active electrode, it is used to apply the electric current to the tissues. The active electrode is used to create incisions and the electric current cuts the tissues and also cauterize the blood vessels to control the bleeding. So the excess material is removed through using the electrosurgical instrument. So what are the advantages? There is controlled tissue cutting, reduced bleeding, and potential disinfection of the surgical site due to the heat generated. So it permits adequate contouring of the tissue and control the hemorrhage. The disadvantage is it cannot be used in patient with poorly shielded cardiac pacemaker. It causes unpleasant odor. If it is touched the bone, irreparable damage may occur. Heat generated by this may cause tissue damage. When electrodes touch the root area of cementum, burns could be produced. Other is the laser gingivectomy. Used lasers are the carbon dioxide and NIDIAG lasers used for excision of gingival overgrowth. Other is by chemosurgery. Chemosurgery is method that is used for gingivectomy that involves the application of the chemical agents to destroy or remove the tissues. So, as similar as the patient is prepared for the procedure, often with the local anesthesia to numb the area is again kept dry. A chemical agent that is a cauterizing or tissue dissolving substance that is applied to gum tissue. So this chemical agent reacts with the tissue, causing it to dissolve or necrose. So that the procedure effectively removes the targeted gum tissue. The chemical agents may control the bleeding during the procedure, and the patient will receive the post-operative care instructions for the oral hygiene, diet, and managing any discomfort or the swelling.